Hey everybody, it's Kara Brindle, co-founder of the Empowerment Model and co-owner of Supervisionary. I have Chris with us again. Hey Chris.
Hey, Kara.
We are going to do another role play for you all today. This one is about goal setting, but also like looking at the goals, evaluation of supervisees, all really important components when doing clinical supervision so that a supervisee knows how they're moving along and obviously have it be more tangible this way. So Chris is going to play the role of supervisor and I'm going to play the role of supervisee. And we're going to jump in and show you what this could look like to revisit goals and look at a supervisee evaluation. Chris, when you're ready.
All right, well, let's get going. Hey, Kara. Good to see you
Hi,
again. How are you doing
thank
today?
you. Doing all right. How about you?
Pretty good, pretty good. So I know we've already talked about this last week, but today we're going to do kind of our first evaluation as you are going through your pre-licensure supervision process. So it's been about 6 months since we've been working together, and typically we'll do an evaluation about every 6 months through this 2 year process. And it's not, I want to preface this that it's not quite like the evaluation in school. So it's not meant to be scary. You're not getting any grades here, but it offers you and I an opportunity to just kind of check in on what goals we're working on as you develop your therapy skills and styles. It also provides an opportunity for me to provide some specific feedback on anything that maybe we've noticed, and then that can inform kind of our goals over the next 6 months. Um, and part of that process is doing a video review. So I appreciate you providing that video last week, working with your client. It gave me an opportunity to just kind of see what it looks like when you're in the room with the client. And so thank you for that. I know it's never real fun to do that, but it really does help us evaluate because most of our work in supervision is me hearing your perspective on what's going on in the room. So just want to say that that's kind of what we'll do over the next year and a half is every 6 months we'll check in, do a video, and then we'll do this collaborative evaluation. How does that sound for you?
Sounds good. You know, I had to chuckle because my program made us do lots of videos, but I still find myself a little nervous about what you might say. So thank you for naming that for me.
Yeah, sure, sure. It's always nerve-wracking when someone else is watching us. So
Yeah.
I understand that and try to acknowledge that. So the way I like to do an evaluation is I really like to do that collaboratively in sessions. That's what we're going to do today, as opposed to me just kind of giving you this evaluation and just kind of grading you and telling you, what I think you need to be working on. I want to really kind of elicit from you what you think are the areas of strength as well as maybe areas that you can work on. So I've sent over this evaluation form, and I think you have it in front of you. So what I'd like to do is just kind of go through each section. And in each section, I'm just going to ask you to kind of look through the several skill sets that we're evaluating and just let me know kind of what you think are your areas of strength, what areas are just sufficient for your developmental area. And I want to just kind of make a note right there that, there's a reason why you do an internship and a practicum and then 2 years of supervised work to get your license. And the main reason is that it takes that long to really develop and master the skills necessary to be a good therapist. So there's a lot of these skills where we're just going to acknowledge that you are at your developmental level with that skill set. So that's to say that you are progressing the way you need to progress to get your license. And then there will be some areas where you have an identified strength. Maybe that's a natural skill or it's something that you've really focused on and worked hard on. And then there might be just a couple of areas where we need improvement. So that's kind of the scale that we're working from. And needing improvement, it's not a bad grade. It's just identifying that this is an area that maybe we haven't been able to address, or we just need some more time to develop. Okay.
Okay. Hmm.
So, just in this first section, it's really talks about professional development. It's really kind of how you learn, how you use supervision, and just how committed you are to this developmental process. So as you look at this several set of skills, I
Mhm.
want to kind of just start off with strengths. What do you think are your areas of strength?
Um, I mean, I think this first one stands out to me, the approach of supervision in an open and collaborative manner. Like I see a lot of value in supervision. I like to show up and be prepared. And so I feel like that's a strength. That's just something I've been practicing since practicum and internship. That one stands out to me as one that feels pretty solid.
Okay. Yeah, and that I would agree with that, Khara. That's why it's been such a pleasure to work with you, and that's so important to my work with supervisees. Is I do think that you really understand the role of supervision in this developmental process. You're very open. You're willing to you come prepared for our supervisions. You have cases, you have questions, and I can just really tell that you're really engaged in the process every
Yeah.
week, not just sometimes. Like every week, you come prepared. I also, want to note that you're very motivated for learning. Like you seem to just be kind of intrinsically motivated to learn rather than having this set of standards that I feel like I need to meet this requirement. I can really see that you are really committed personally to this growth process.
Thank you.
Um, yeah, and I think that's the basis for this developmental process is to be able to know how to use supervision and how to kind of continue to use supervision openly in this process. So to me, that's the critical foundation for all of the development. So I think you're doing a great job there. So good work. Um, let's just kind of look at maybe areas that maybe could use some improvement and see, let me know if there's any on here that maybe stand out of areas that you might struggle with.
Yeah, I mean, I think right away, it's the second one from the bottom. It says appropriately questions and challenges colleagues and supervisors. Like that makes me nervous. I'm new to the
Okay.
field. I already have like a thought of like, what do I have to contribute and why would I challenge my colleagues?
Okay. Okay. All right. That sounds good. I've actually noticed that you seem to appropriately push back with me whenever I kind of share something that's maybe doesn't sit right. Maybe the word challenge is where you're getting caught up, that it feels like I'm being confrontational. But what I've found is that you very appropriately kind of question anything that doesn't feel quite right. And it's never been in like an antagonistic way. I've just noted that, if something doesn't set right, you're the type of person that needs more information to kind of really, be committed to doing whatever we're talking about. So I've actually I can recognize that maybe it causes some anxiety in you. But I've actually found that you do that really well. We can talk a little bit more in our supervision over the next 6 months about the anxiety that it brings up. And I hear a little bit
Right.
of imposter syndrome in there that I'm young, I don't know, like I'm not sure I'm confident enough to challenge a supervisor or someone that's been in the field for a long time.
Right.
To that note, I think that going back to the kind of evaluation process in school, it kind of instills this idea of this top-down learning experience, and it kind of invokes this idea that people who've been in the field for a long time, whatever they're doing is the right way to do things. And what I really look at it as there's many different styles. And much of this pre-licensure process is for you to develop your style. So that's going to naturally look differently than anyone's style. So sometimes that anxiety about having a different perspective on things is actually just an indication that you have a different style than someone else. It's not necessarily their experience supersedes your knowledge base. It's just that you
Right.
do things differently, and that's okay. But we
Right.
can work on that. Maybe that's a goal that we'll kind of set aside for the next 6 months.
Sounds
Um,
good. I like that.
yeah, good, good. The one thing I want to kind of note in this area that I think is, and I don't know if it's a need for improvement as much as just I want to keep an eye on it, is the appropriately self-critical and accurately assessing self. As I've gotten to know you, I recognize that sometimes you can be a little perfectionistic, and you've kind of shared that with me, and sometimes I do see that as you're evaluating the work that you're doing with the client. I really see sometimes that self-critic show up when things, maybe when you get into an area with the client that you've never done before, like they maybe dealing with a topic that you've never worked with before, or maybe picking up on something from the client that kind of brings up some feelings of self-doubt, thinking that what is the client getting out of this? I'm not sure I'm doing anything for the client. That's some of the words I've heard you use.
Right.
And while I think it's good to like really evaluate how we're doing, the real critical piece of this is appropriately self-critical. Like we want to be self-critical to the extent that we're challenging ourselves to get better. But sometimes I think, that perfectionism kicks in and you're really beating yourself up over something that is not necessary and actually may be more likely to interfere with your work with the client than if you can just be comfortable with where you are. And I just want to kind of hear from you. Does that seem accurate? And anything you want to add to that?
Oh yeah, I mean, I definitely feel seen. I think, I'm continuing to work on my perfectionism in my own individual therapy, but you're right. Like, I think I get stuck in this, like, there's one way to do this and to do it well. And you've kind of already named in our evaluation today that there's lots of ways to do things. And so, I'm not looking at a manual and be like, I have to do it perfectly or step by step. Um, so that's a work in progress. So yeah, I think that should probably be an ongoing goal for me because I continue to have to track the perfectionism and when it shows up.
Okay, that sounds good. Let's work on that. Again, I don't think it's like a major issue. My biggest concern is your own suffering in it, that you're just adding weight to the work that we already do, which is already heavy. So I just want to do that. It's also really important for sustaining a long career. The more we can feel comfortable with ourselves and not put as much pressure on ourselves, the longer we're going to be able to do this work.
I like that. Yeah. Okay.
Cool. All right. Well, let's move on to the next one, which is more kind of assessment skills. So now we're actually talking about actually doing therapy, not the way we use supervision. So the first area is in the area of therapeutic alliance, and just kind of curious what your perspective is on your strengths in this area and any areas of improvement.
Yeah. I mean, I feel like I have pretty good rapport building. The one area, and you and I've talked about this before, and as I read through this list, the one area I continue to trip up on is the label of like how I introduce myself, like pre-licensed candidate. It's kind of like when I came to you and started this process, I said I was tripping over like saying I'm just an intern. And so you were one to reflect to me like, oh, you're discounting your own abilities because you're saying I'm just an intern. So that one's standing out in the list of like it's still a work in progress to say it with confidence or to be like I have something of value here. I'm sure that is pretty normal for a green clinician though.
Yeah, it is. It is very normal. And I think it goes back to that conversation we just had about
Mhm.
just kind of knowing where you are in the field and understanding your knowledge base and what you want to learn. And when we're a little uncertain about that, then the way we present ourselves to the client can kind of show up there. Well,
Yeah.
tell me a little bit though about your strengths in this area, because we went straight to the struggle
Uh-oh.
area, which is kind of
The
kind of,
critic.
I think we just touched on that a
Oh,
little bit.
that's so funny that you noticed that, of course. Let's see. I think the warmth, genuineness, and empathy are pretty easy for me.
Yeah,
Um,
I
I
agree.
like to approach it with curiosity, and I feel like I'm a little silly sometimes, and most clients that disarms them, or they seem to like that okay for the most part. Yeah, I would say that one's a strength. That one right there at the top of the list.
Yeah, I definitely agree with that. Like and you can, I can feel it in our supervision, just your personality, it really is authentic to you. It's clear how much you care about your clients. And it really showed up in the video. It's pretty clear as I watch your video that you and your client have really good relationship. And that's something that I'm sure has taken some time to develop, but seems to be a real like natural skill for you. And you know me, like I'm a humanist through and through, so in my mind this is a critical skill to the work we do. Some people think, oh, like, you're just a nice person, that doesn't necessarily make you a great therapist. And in fact, I believe that it's actually a natural skill that should be built from, rather than just kind of dismissed as like, oh, you're just nice or warm.
Right.
So um, yeah, good. I would agree so far with everything you've shared. I just want to note that we've talked a little bit about just the challenge of self-disclosure and kind of knowing the line between when to self-disclose and when not to. I don't want to identify this necessarily as an area that needs improvement for you specifically. I just want to acknowledge that most people in this kind of pre-licensure process kind of struggle with that, and it's something that tends to come up several times, like, when can I self-disclose? When am I, kind of crossing this boundary where my
Right.
self-disclosure is more for me than for the client? And just a reminder that when we think about self-disclosure, we just really think about how will the client benefit from this information.
Mhm.
And sometimes it's very appropriate, and the client can really, benefit from hearing that, oh, my therapist struggles with the same things sometimes, without you getting into the detail and turning it into your own
Right.
therapy. So
Right.
again, I don't think that this is necessarily an area of weakness for you, but just acknowledging that most people in your developmental stage kind of struggle with that, finding that line. So we'll maybe kind of continue to work on that and have discussions about that.
Yeah, I would really like that. I think I had mentioned to you my program was very anti self-disclosure, and then to come into the work and be like, this is okay. It's new for me. I only had one professor who was like, it's okay, and said something really similar to you of like, has to have a purpose, has to be for the client, has to be short and sweet. She called it a short stack, a pancake image, like three pancakes. Um, and so, yeah, I think I do want to continue to work on that because it still feels foreign coming from a program that's like, don't do it, and then starting to warm up to the idea.
Yeah, yeah, yeah. I know that this is something we've talked about, but it's a real work to kind of take these kind of rigid things that we were taught in school and then realize when you get into the field that they're not quite that rigid. Like, it's
Mhm.
really important to have some parameters, but we don't have to be so rigid as to say we never do something.
Right.
And that'll show up in many of the things we've talked about, as it has already. Um, so we'll just keep an eye on that and chat about that. Yeah. And then, of course, as you mentioned, that confidence, we'll continue to work with that. All right,
Sounds
let's
good.
move to the next one, data gathering skills. So this is more kind of like, how do we, really kind of assess a client with not just what questions we ask, but seeing their, nonverbal communications, body language, and using, this whole host of skills to really understand where our client's at and continue to assess treatment goal plans, any concerns about safety, um, things like that. So let's just go
Mhm.
through this one and kind of, again, let's start with our strengths before we identify any areas of improvement.
Um, let's see. I think the nonverbal communication's pretty solid. So funny, I can see the ones I want to improve upon, which I'm sure you hear from all your supervisees. And I feel pretty good about assessing for dangerousness. I haven't quite seen it written this way before, but like I think you mean like risk, right? Like suicidal risk or like homicidal
Yeah.
risk. And
Yeah.
I had some really good training in my program around that. So I feel like those two are pretty good, pretty solid.
Yeah, I would agree. I would agree. You are, because of your experience and internship, it does seem like you got a little more training in that area than most people in your developmental stage. It's a tricky thing because you really have to, you have to do it to gain that skill set. And there are some supervisees I work with that just haven't had that experience. And so trying to prepare yourself for these situations when you've never been in the situation is much more challenging. Whereas I know had some experience an
Mhm.
internship doing this stuff. So I would agree that that's a real area of strength. I really noticed that you are well above most people at this stage in that area. So good
Thank
work.
you. Thanks.
Yeah. Yeah. And yeah, I think that you're really good about, not only focusing on what the client says and the words that come out of their mouth. Sometimes we get too literal about the words they say, and we kind of lose the big picture of noticing, like, when a client is saying something, but their mood, maybe is saying something different, or their body language is saying something different. You seem to do a good job of like picking up on those discrepancies and being able to bring attention to the client that you're telling me everything's all right, and but yet
Right.
you're not smiling and you seem like you're kind of really struggling. So I think you do a really nice job with that. um,
Thank you.
any areas in this section that you find is a bit of a challenge?
Uh, the ones that stand out are the question of like transference and countertransference. I feel like I'm still figuring out what that looks like and feels like. I mean, that's where I'm so grateful to have supervision, right? Where I can come to you and be like, is this countertransference? And I think that ties into this first one, which is like it says aware of impact of own behavior on culture and culture on client behavior. So like I feel like I'm pretty self-aware, but I also feel like I don't know what I don't know. And so those two kind of stand out to me as ongoing.
Yeah, yeah, and real normal at this stage. And I would agree, talking about countertransference and transference is kind of challenging. First of all, we have to really understand what transference and countertransference even means,
Mhm.
right? And then once we understand that, there is like an element of when we talk about transference and countertransference, we are talking about some personal stuff, and
Right.
I know we've talked a little bit about the line, between bringing in personal stuff and the way it impacts our work, and also making sure that it doesn't spill into therapy. And I know we talked about that a little bit in our first session, that can be a real challenge, that you might err on the side of caution of not sharing anything as a way to kind of protect your personal privacy, which makes sense. And I would say that it is helpful if you can bring in something that's impacting your work.
Mhm.
As we've talked about, if it's something you need to work through therapeutically, you should do that with your therapist. But if you
Right.
notice that it's coming up with a client in session, or not sleeping because of something that's going on with the client, then it's very appropriate to bring into session. And so, I don't think it's so much like an area of weakness as much as, again, at this developmental stage, these kind of concepts are pretty new and do take some work to feel comfortable with it. So I just welcome you to continue to take some risks in our supervision and sharing anything that comes up.
Sounds good. Thank you. So I'm
Yeah.
gonna I'm gonna pause here,
Okay.
just for like the processing moment, because obviously I'm very impressed, Chris. Like for viewers, Chris and I have known each other for maybe we've met like 4 times, and he's pulling real information and obviously some made up information because I'm not a green clinician at this stage. This is a very thorough evaluation, right? So like I know folks can't see this on screen. Each of you are going to have a different way of doing this, but like hopefully you're getting a sense of like what the style can look like, what it looks like to actually engage a supervisee. What would you add, Chris, of like things that people should take away from this process, this evaluation?
I think just the most important is piece is that it's collaborative, and you've heard me say this over and over. You can clearly see that my style is everything should be collaborative
Yeah.
in supervision. And the reason I believe that is because I believe that everything should be collaborative in therapy, that as a therapist, you should be collaborating with your clients. You should be eliciting feedback from them on how therapy is going, what is working for them, what isn't working for them, and be able to adapt. And so, as you've seen, I really try to, create that parallel process in supervision where I work with you in a way that I would want you to work with your clients. So,
Right.
collaboration, anytime all of us at some point, perfectionist or not, we have emotions about being evaluated, about being
Mhm.
graded. So if I were to just send you this supervision, evaluation, and say, hey, we'll talk about this next week, you're going to naturally go through that and notice everything that's negative.
Mm.
And you're going to fixate on it. And you might come up with your own narrative about it before we even get a chance to talk about it.
Right.
So that's why I don't even like do the evaluation until we meet. And
Mhm.
so we're actually going to do it together. So that would be my takeaway point here.
Yeah, and so that's one style. I love that you named that because the little research study we did here at Supervisionary, we asked people to do the evaluation ahead of time and then look at one together with their supervisor. And what we found is that people under evaluated or underrepresented their strengths, but they're like looking at it with the negativity lens or oh, imposter syndrome or whatever showed up. And so I can see the value of both, especially if supervisors can take that and say, let's look at it in contrast to what I think of you. And here are your strengths, and here's what I believe you're doing well at. So I like both styles for different purposes. And so for folks who are like, oh, this is awesome, where do I get an evaluation? Do you build your own? I mean, each of us kind of have our own thing. I will make a plug for Supervisionary's evaluation that you can download on our website for free. It has different categories, not quite as robust as Chris's that I've just seen here for the first time today in recording this. But maybe everyone can use that as a starting place and then flesh out some other criteria based on what you cover in supervision. Chris, any final thoughts for viewers on this process?
Yeah, I think, just to your point there is that there's no right or wrong way. This is just my style. Again, going back to we all have different styles.
Right.
Different styles don't mean right or wrong. They're just different styles. I can see the value in a lot of different. We could break this evaluation into chunks and just focus on one section for the first 6 months and the next section for the next 6 months. We could have the therapist fill out the evaluation themselves in advance and then talk about it like you mentioned. So I think there's a lot of different ways to do this. I
Mhm.
think the most important part is to be clear as to what your goals are with the evaluation
Right.
and what information you're trying to elicit and then what you're going to do with that, which is really this should be informing our next set of goals in supervision.
Mm. Yeah, yeah. So having those tie nicely back to, okay, we talked about self-disclosure as a goal. We talked about countertransference awareness as a goal. So being able to use this as like that roadmap towards here are the next goals for the next 6 months. I really like that. I feel like that's
Yeah.
very tangible and visual, and people can really say, oh, yep, I know exactly where I'm headed. So I like that a lot. Well, Chris, I appreciate you. And for having not known each other very long, I feel like I have a very good sense of how you do things, and I love your style. So I'm just going to give you a shout out on this video as well.
Thank you. Thank you. This has been really fun for me too.
Yeah, well, I hope everyone's feeling inspired by what this could look like. Obviously, you have your own spin on it, but we wanted to show you what it could look like in real time because not everyone is doing evaluations or have questions about what it could look like. So from this video, you hopefully have some new ideas. We'll see you in future role plays and future videos. See you next time.